Pain that won't go away. Tonight, we hear from two patients who tried surgery, medication, and therapy, but nothing worked until they found an Idaho doctor who looks at pain in a whole different way. Andrea Ahmed Zaid has suffered from an unstable back for decades.
It was some of the most incapacitating pain I'd ever experienced.
So bad she could hardly do this, walk.
Because I am a retired therapist who has worked in the medical field, I like to do my research.
And that research led her to Dr. Clint Mallory, a board-certified pain specialist in Boise, who doesn't treat pain the usual way.
It's called intramuscular stimulation, and it's basically a Western idea of treating pain using an acupuncture needle.
But don't be confused, it is not acupuncture. IMS needles go deeper.
It's based strictly on stimulating nerves, peripheral nerves, and releasing the muscle. It's like rebooting a computer or pushing a reset button on a muscle or a group of muscles and nerves that have been injured. The treatment is immediate. The needle only has to be in the tissue for a millisecond.
Rick Thompson had spent almost 4 years in pain. That included surgery, medications, and injections. Then he found Dr. Mallory.
But when he gets the nerve that needs to be corrected, I might jump a little, but that's great because then the pain is gone.
How's it feel, Rick?
Feels great.
So good that Rick is skiing and biking for the first time in years. Not only is the IMS working, but inside the same office, he's getting even more relief from what looks like a simple device.
We're introducing light into the damaged cells, and that causes the healing process to speed up.
It's called cold laser. David Stem says patients in Canada have long had access to it. The FDA approved it for use here in 2004.
Why is it called cold laser?
Because it's athermal. There's no heat. It doesn't give off any heat.
But it does penetrate the tissue, repairing damaged cells and getting the body's natural healing process going again. Remember Andrea, who could hardly walk months ago? She says both the cold laser and the IMS gave her her life back.
You actually do kind of feel a sense of helplessness, a sense of frustration, because you can't do what you want to do when you have that kind of pain. And now I feel like, golly, here I am back out gardening again, and I can even go dancing.
Dr. Mallory hears stories like this all the time. He's been in practice for 20 years.
It's as if for the first time you have actually validated their pain.
And he listens to them. Dr. Mallory says if you don't get to know a patient, you'll never be able to heal their pain.
You actually touch with a needle what they have thought about, what they could feel, but could not describe in words. But when the needle hits that spot, it's a release of emotions, a cathartic release for them. Those are things I've learned from my patients.
And I should tell you, if you're wondering if the needles hurt, Rick said absolutely no. If you'd like to learn more, you can call the Center for Pain Care in Boise at 342-4700, or for information on the cold laser, you can call 954-7334.